About 20 years ago, a real push for evidence-based medicine started, and in 2002, the World Health Organization organized the Consultation of Acupuncture, which came up with a list based on 255 clinical trials of signs, symptoms, and conditions where acupuncture could be of benefit. Also on this slide, it's little, but there's a symbol here for the American Medical Acupuncture Association, which is MDs who practice acupuncture. And they were part of the process in using that list to decide which symptoms could be treated in the hospitals and used in the credentialing process. So the New England Journal of Medicine in 2010 released a combined statement between the American College of Physicians and the American Pain Society that said when usual care is ineffective, consider acupuncture to treat chronic low back pain. 126 million people suffer from pain every year in industrialized countries, and 40 million of those have chronic pain. 30 to 40% of those people have used complementary approaches over the past year, including acupuncture. So what is pain? Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. I think we all need to avoid lobsters. So acupuncture has been theorized to affect pain in the following ways. The natural opioid substance theorizes that acupuncture actually affects the level of endorphins and other opioids in the cerebral spinal fluid. The neural gate theory is something that some of you are probably familiar with, and that's that the spinal cord actually acts as a neural gate to either enhance or reduce the message of pain to the brain. The endogenous corticosteroid release is the presence of a needle. It may actually stimulate both vascular and immunomodulatory factors, including those of local inflammation. We're going to be talking a lot about the myofibrillary entanglement today, the idea that stuck muscle fibers can be released with an acupuncture needle in a trigger point, and the mesolimbic loop of analgesia is the link between the brain and the limbic system, and there's actually 4 pathways where dopamine is found, and with chronic pain it's many times not in balance, and so the theory is that acupuncture actually acts as a reset to this pathway. In a randomized controlled trial, there were 12 studies that were looked at, and 9 were suitable for the meta-analysis. And what it showed, one of the things that I came across frequently in looking at evidence-based studies for acupuncture was, how do we know that it's really working? And so there were 3 categories in most studies. One was a control group. A second was an acupuncture prescription that was known to treat a specific problem. And the third was called sham acupuncture, where random needles were either inserted at places that weren't effective for that particular problem, or they pretended to put a needle in, but nothing was actually inserted into the skin. So in this controlled trial, it broke down, it took 9 studies, and based on the p-values, it showed a significant difference between acupuncture for chronic low back pain and sham acupuncture. This next study is pretty interesting to me. It's called the Carlson Study. It's out of Sweden, and it had 50 patients in it. Some of those were disqualified based on their symptoms. The inclusion for the study was low back pain longer than 6 months, and negative for radiculopathy, as well as normal they had to have normal neurological findings. The study was done 1 acupuncture treatment per week for 8 weeks, followed by a follow-up 2 months later, and a 10th visit was 2 months after that. What's interesting about this is that many of these patients actually had a history of nerve blocks, analgesia, physical therapy. They'd done TENS, they'd done exercise, they'd done heat, they'd done cold. During this treatment, or the study, they agreed not to have any other treatments besides acupuncture. So sometimes pain is subjective. What's not subjective is medication. So this was a randomized controlled trial. And interestingly enough, the people in the acupuncture group were actually, they were on or taking a higher level of medication at the beginning of this study. And the acupuncture pill use group was taking 31 a week, and at the end of this study, they were taking 21 pills per week. In the placebo group, there was only a 1.5 pill difference after the treatment of acupuncture. Other findings based on the VAS scores, and there were 14 patients who were on sick leave at the beginning of the study in the acupuncture group, and 6 of these went back to work full or part-time, and the rest were retired but said that they improved and their pain reduced. Only 1 person in the placebo group returned to work during that time. So there's many different types of acupuncture. There's Korean hand acupuncture, there's Vietnamese, there's Japanese. Most people don't know that when they pick up the phone and they call an acupuncturist. And there's medical acupuncture. And today we're talking about 3 different kinds. There's neurofunctional acupuncture, which has several different names. It's trigger point, dry needling, intramuscular stimulation. It's also called musculoskeletal acupuncture. The second kind is meridian or distal therapy, and the third is auricular therapy or ear therapy. So I'm going to flip back and forth between 2 slides here. Neurofunctional acupuncture has primarily 2 parts to it, sometimes 3. And I always call it, it's addressing root and branch. So in treating low back pain, the example I'm going to use today is involvement of a muscle called the quadratus lumborum. So when people come in with one-sided back pain, this is a muscle that's frequently causing the problem. It's commonly seen with baseball players, golfers, and it's definitely seen after a heavy snow in Colorado where people have been snow shoveling all day. And so we get the phone ringing a lot after those types of situations. So there's 4 main trigger points in the quadratus lumborum, and it's innervated by T12 through L4. And so what an acupuncturist, a physical therapist, a qualified practitioner is going to do is they'll palpate the levels along the spine and look for places of tenderness. There's a muscle called the multifidus. It's a stabilizing muscle, and this becomes inhibited when people have back pain. And what a therapist is going to do is they're going to go in and actually stimulate that muscle. And usually they actually put that needle in all the way down to the lamina. They'll actually tap on the lamina. So it's a needle that's about 3 to 4 inches long, and they'll encourage a muscle spasm to happen. So when you have pain, a muscle will sit in a partially contracted position in a spasm, and if we go in and we twitch that muscle, it causes a chemical reaction to go down that muscle fiber and encourages that muscle to relax. So when it's in a neutral position, it can fire in full range of motion. So the first thing we do is we go into the multifidus to turn that on or release that spasm. And the second thing that we'll do is to go into those different trigger points. So the X's are the trigger points. Those other areas that are demonstrated here that's actually where a patient might come in and say, I'm experiencing pain, it's hard to sit down, it's hard to turn. So the pain is actually in a different place than where the problem is coming from. So up here we talk about a filiform needle, and I wanted to show you what that is. So a filiform needle is an acupuncture needle, and they range in size from about 0.12 to 0.35 millimeters, and they can be anywhere from 1/2 inch to about 8 inches long. And that really depends on the anatomy of the individual person and also on the problem or the condition that we're treating. Typically, we have more cushion on our backside, so the needle's determined by where we're working. Times when it would be appropriate to use this technique, local hyperstimulation. So if we touch a patient and they get what's called a pilomotor response, if you're a practitioner and you're touching your patient, you notice goosebumps where you're working or sweating that starts when you touch them, that's called a pilomotor response. Allodynia, a heightened pain response, and also radicular symptoms are signs that this would be a good technique to use. Another one of those is ischemia. If you notice that someone has a discoloration of their skin in a particular area, they're not getting good blood flow, or you notice changes in temperature. So every part of their body is warm, but you touch their low back and it's really cold. These are times that it might be helpful to use this treatment. So a trigger point complex for a practitioner when we're using our hands every day, it's a knotty, ropey sensation. It's fibrous tissue, and the trigger point is at the center of the muscle belly, where the motor end plate enters the muscle. And what we're looking for is a full contraction of that muscle, and then the opposite of that would be that reset to neutral. And I always say neutral versus full relaxation, because we still want that muscle engaged, we just don't want it in spasm. So the third part of the treatment that I was talking about is to really assess the other muscles that are involved. If you flexed your bicep, your tricep should be relaxed, and vice versa. And the low back is pretty complex. So besides just looking at the quadratus lumborum, a qualified practitioner is also going to address what's called an agonist and antagonistic relationship, which means that if the QL is firing, that muscles, glute med, glute max, glute minimus should be more relaxed. It's a reciprocal relationship. And so making sure that those are moving correctly in full range of motion is part of what makes this treatment successful. Neurofunctional acupuncture is frequently utilized by acupuncturists, physical therapists, physiatrists, and chiropractors. It's, as it says on the screen, requires a strong grasp of anatomy, innervations, and biomechanics. There are limitations to this technique. It's very effective, but it can be painful for some people. I find that athletes respond really well to this technique, while someone with fibromyalgia, or it wouldn't be appropriate typically for someone with complex regional pain syndrome. Sometimes that can flare them up. It also has an inflammatory response. One of those chemicals that's released in that relaxation is lactic acid. So I always tell people, you may have soreness, but you're going to be in less pain. So if they're close to game time, this is probably not the best technique to be using. The other is that it has limited use in the hospital due to the risk of infection. You can't work in the site of surgical procedures, so it's typically not utilized directly after surgery. So this next slide is my very favorite slide of all times. It's a comic, and I think it might be kind of hard to read, so I'm going to read it to you. And it's on meridian therapy, and it says, thank you, my enemy. I'm very grateful to you for shooting me in the leg. You just cured my shoulder pain. I think traditional Chinese medicine and acupuncture is a little bit hard to describe, and it's just started. So I have a little video for you guys to watch. It's 1 minute and 30 seconds.
Acupuncture involves stimulating body walls like skin and muscle to produce therapeutic effect. It can be used for a very wide range of conditions: acute pain, chronic pain, and respiratory conditions, skin problems, and gastric problems. So if you can imagine your body is a city. So in a city there are big roads, highways, there are small roads, there are landways. So if everything's fine, the traffic goes nicely. So when there's a car breaks down, and the traffic will jam up. And if the broken car is not being fixed, the traffic jam will become worse and worse. Let's imagine in the body there are meridians. And in these meridians we have qi flow, we have energy flow. Say for instance, if you hurt your back, and the local muscle will become very tight. And this kind of tightness is a way of blocking the qi flow. So to restore that, to reduce that problem, we have to put needle into the local area to help the broken car in a way, but also we will put needles away from your back to divert traffic, to restore the qi flow.
So that's Dr. Jana John. She's from the Royal Melbourne Institute of Technology, and she's a senior lecturer in the School of Health and Biomedical Sciences. I actually started my degree at the University of Technology, Sydney, and the acupuncture program goes along with the nursing program, actually, so that nurses are taught how to administer acupuncture. That's a side note. So with meridian therapy and distal acupuncture, this is a different language. So we're talking about the same thing, but we're speaking a little bit of a different language. And when a practitioner talks about low back pain, they might be talking about the quadratus lumborum. What the acupuncturist is thinking is, this is affecting the bladder meridian. And so how do we affect change or find the road that might unblock this traffic jam when there's congestion or stagnation? Has anyone ever been told if you have a headache to push on your hand in here? Has anyone ever heard that? That's actually good for a frontal headache. If you have an occipital headache, we can show you how to help that later. But what Chinese medicine relies on frequently is an idea of imaging. So they have two different anatomy charts. One has your hands up here and the other has your hands at your waist. So the hand actually becomes an image of the face, and the wrist actually becomes an image of the neck. While this might be hard to understand, it opens up a lot of possibilities for treating in acute situations where you can't go into the area of pain. With low back pain, for instance, there's 3 different ways that we can treat it without ever getting close to the site of surgery. And these lines indicate where we would palpate to find areas of pressure or pain, and that's where the needle would be inserted. The depth of where we put the needle depends on the injury. So if someone's had spinal surgery and we're supporting that, it would be a deeper insertion almost down to the bone, where if someone had complex regional pain syndrome, we would be needling more superficial because it's affecting the skin. If there's an analogy, if there's any engineer type minds in here, one of the ways that we say this is that if you want to fix pain, or if you want to turn out the light, do you unscrew the bulb in the ceiling or do you go to the switch on the wall? There's several different ways to think about an approach to the body. So this is a preliminary study. I debated on putting it in because of the test size, but I thought it was pretty interesting. It's a SPECT image. This is one patient, and these 3 images are prior to acupuncture, and then the bottom row is 20 minutes post-acupuncture. And what it shows is the thick area, and neurosurgeons might have to correct me on this, is the thalamic activity, and the thin area is the basal ganglia. And what they found was that in chronic pain, there was asymmetry between the left and right sides, and that after acupuncture, these equalized. So it's a preliminary study. The author noted the flaws with the study. There's small test sizes. There were 7 people in the chronic pain category, and there were 5 people in the control group. But what was significant is that all the people, the 7 in the chronic pain, all had asymmetry, and in all of them after acupuncture, these sides equaled, which shows great promise in terms of chronic pain. And it also leads the way for future studies, maybe to look at how it compares to pharmaceuticals, and also to learn more about if it's actually having an effect on the neurophysiology itself, or if it's a response to the distal acupuncture in the body. So the benefits of distal acupuncture: a person could be in a chair. Distal just means far away from the place of pain. And they could be on a chair, on a treatment table, in a hospital bed. The results should be felt instantaneously. It's not something that they should be thinking, oh, well, I feel a little bit different 2 or 3 days later. If an acupuncture needle is in the right place, within about 10 seconds, there should be a shift in the pain. And to take away placebo effect, we ask open-ended questions. We say, where's your pain now? And hope that as that reduces, we know we're treating in the right place. So an example of this in the hospital, we were recently called in to work on a patient with a glioblastoma who was in 10 out of 10 pain and having nausea from the narcotics. So he was refusing opioid management of his pain. And at 15 minutes, his pain with acupuncture, with no needles placed anywhere in the head region, had dropped to 5 out of 10, and at 40 minutes, the patient was sleeping. So clearly this isn't going to cure a brain tumor, but it does have the opportunity to provide some relief to pain and can help with some of the side effects that can come from opioids. So the last thing I'm going to talk about, I'm really excited to talk about, is something called Irregular Therapy. And the father of Irregular Therapy is a man named Paul Nogier. And what he noticed was that there were workers who were walking around with scars in their ear here. And when he inquired about it, they said that they had their ears scarred to help treat low back pain. He found the person who was doing that. It was a woman named Madame Barron, and she was cauterizing the ear down to the cartilage to treat low back pain. So instead of dismissing this as a hoax, he decided that he would research this further and started investigating with the idea that if it could treat pain in the low back, that there were probably other parts of the ear that addressed other parts of the body. And what he discovered was a picture of a homunculus, an upside down figure, where a lot of the imaging for the spine actually came through here. I'm going to try to speed up just a little bit because I see I'm running out of time. So the next slide is a study from the American Society of Clinical Oncology used with acupuncture. There were 3 groups, and what it was found was a 36% decrease in pain over 2 months utilizing auricular therapy in conjunction with cancer treatments. So it's far-reaching. Auricular therapy can be done really fast. probably in 5 minutes you can put 10 needles in someone's ear. And if that could be done in conjunction with other treatments, it might help reduce people's pain. So there's 3 people here to talk about. Paul Nogier, we mentioned a little bit. And very briefly, I'm going to skip over some of Dr. Stanton, but he's a neurologist and a national speaker on irregular therapy. And part of why I put him in this talk was because he's combined irregular therapy, pain management, medication, and physical therapy to help people manage their pain. And he's the head of neurology at Concord in Emerson Hospital in Concord, Massachusetts. And then Dr. Needles, I'll go in depth with further in a minute. So I just quickly want to say a little bit about how this works. What Dr. Nogier discovered is that there's several types of tissue that develop in utero and change. They become the other types of tissue in your body. So the ectoderm becomes your cerebral cortex, your pituitary gland, your blood vessels, your lymphatic. It's a long list. The endodermal tissue is your respiratory tissue, your digestive tract, your bladder. And the mesodermal tissue is your skeletal muscle and your cardiac muscle. And what he discovered is that all 3 types of this tissue still exist in the ear. And so the theory is that it can have a global effect on the body, on these different types of tissue by accessing those parts of the ear. And so to create a different picture, the upper extremities, the lower extremities, parts of the spinal cord are all shown on the ear and can have a global effect on the body. Acupuncture works a lot with microsystems. And I'm almost out of time, so I'm going to just hop ahead here. These are what are called ASP needles. They're acupuncture SemiPermanent needles. They look almost like a little dart. And they are put in the ear and they can be left there for anywhere from 1 day up to 3 weeks. The body is allowed to push it out over time. They come in stainless steel, gold, and titanium. And the benefits are great because they could be used, for instance, in an ER room, in a triage experience where people are sitting in the waiting room for a long time experiencing pain. They could have these put in, and the titanium ones won't affect any kind of imaging. They can go through an MRI machine. And specifically, I wanted to talk about this. This is called battlefield acupuncture. Dr. Richard Needles is a radiation oncologist, 40 years in the military and the first acupuncturist ever admitted into the military. He did several studies under functional MRI that showed, he figured out a protocol that worked on the central nervous system, and he's taught this to physicians and soldiers. It's been used frequently in Iraq and Afghanistan, where soldiers were taught to administer this to each other. It was used for anxiety, it was used to manage pain, and it allowed people or soldiers to complete their missions because they weren't under any kind of medicine that would affect their thinking. It could also be used before they reached a medic station to reduce their pain. One of the biggest problems that's affecting soldiers these days is painkiller abuse, and I think some of this comes from PTSD as well as from physical pain that they're having. So they're actually utilizing it a lot more in the military. A case study with 100 patients who walked into an ER, military ER, and they were offered the usual care as well as these acupuncture points in the ear. And they were contacted 24 hours later. 13 of them couldn't be reached. 23 of those never took any medication. And they were called 24 hours later, and 6 of them who got prescriptions chose not to get them filled. So opiate-related adverse drug events affect 20% of people treated post-surgically, and those numbers increase as when patients have other comorbidities. And I really enjoyed listening to Dr. Rajpal's talk about low back pain and working with the elderly. The elderly want to remain independent. They want to stand at the kitchen sink and wash the dishes and not be in a home. So what they want is pretty basic. They just want a reduction in pain. They're not looking for 100% clear, and they can run into complications with surgery. So sometimes if acupuncture is administered, they might need less medication, which reduces their complications. So this last study is there was a significant decrease in acupuncture in groups 8 and 72 hours post-surgically, and also a reduction with acupuncture, a reduction in the amount of opioid pain medication. I just wanted to say it's really great to be here, and the goal for this presentation is just to say that there's not one size that fits all for all patients, and it's been a great opportunity to be here today and talk a little bit more about some of the ways that acupuncture and allopathic or standard medications can work together.